Have you ever walked into a doctor's office, looked at the growing list of tests and screenings being recommended, and wondered, do I really need all of these? If you're over 65, that question becomes even more important. Because here's something that may surprise you: more medical care does not always mean better health care. In fact, some screenings and checkups that were helpful earlier in life may offer little benefit later on. And in certain situations, they can even lead to unnecessary stress, false alarms, additional procedures, and risks that many people never hear about. Today, we're talking about 5 medical checkups that some doctors carefully reconsider after age 65. Now, before we go any further, let me be absolutely clear. This is not a list of tests that everyone should avoid. Every person is different. Your medical history, family history, current health, medications, and overall life expectancy all matter. The goal of this video is not to tell you what to do. The goal is to help you have more informed conversations with your doctor and understand why some screenings may not always make sense for every older adult. And make sure you stay until the end, because the last item on this list is one of the most commonly misunderstood screenings in medicine. Millions of older adults continue getting it every year without realizing that many medical organizations recommend a more individualized approach. Let's begin. The first medical checkup that may not always be necessary after age 65 is routine prostate cancer screening with a PSA blood test for certain older men. Now, prostate cancer is a serious disease. There is no question about that. But the relationship between PSA screening and improved outcomes becomes more complicated as people get older. The PSA test measures a substance produced by the prostate gland. Elevated levels can sometimes indicate prostate cancer, but they can also be caused by many non-cancerous conditions. Here's where things become important. Some prostate cancers grow very slowly. In fact, many men can live for years or even decades with a prostate cancer that never causes symptoms or affects their lifespan. When screening identifies these slow-growing cancers, it can lead to biopsies, surgeries, radiation treatments, and significant anxiety, even when the cancer may never have become a problem. Many experts now recommend that decisions about PSA screening in older adults should be individualized rather than automatic. Factors such as overall health, life expectancy, symptoms, family history, and personal preferences become extremely important. Imagine 2 different 70-year-old men. One is active, exercises regularly, has no major medical problems, and expects many healthy years ahead. Another has several serious chronic illnesses that significantly affect his overall health. The benefits and risks of PSA screening may look very different for these 2 individuals. This is why modern medicine increasingly focuses on personalized decision-making rather than one-size-fits-all recommendations. The conversation should not simply be, should everyone get this test? Instead, the question becomes, does this test make sense for me? The second checkup that may not always be necessary after age 65 is routine cervical cancer screening for many women who have had consistently normal results throughout their lives. This topic surprises a lot of people. Many women become accustomed to regular pap smears over the decades and assume they must continue indefinitely. But medical recommendations have evolved as researchers have learned more about how cervical cancer develops. For many women who have had adequate prior screening and no history of serious cervical abnormalities, routine cervical cancer screening may no longer provide significant benefits after a certain age. The reason is that cervical cancer typically develops slowly, often over many years. When a woman has a long history of normal screenings and low risk factors, the likelihood of finding a dangerous new abnormality decreases substantially. However, this does not mean every woman should stop screening automatically. Women with a history of cervical cancer, significant precancerous changes, immune system disorders, or other risk factors may require continued monitoring. The key takeaway here is that age alone does not determine what you need. Risk factors matter, medical history matters, and perhaps most importantly, conversations with your healthcare provider matter. One of the biggest misconceptions in healthcare is the idea that screenings must continue forever simply because they've always been part of your routine. In reality, good medicine involves continuously reevaluating whether a test is still providing meaningful benefits. Now let's move to number 3, and this one affects a huge number of people. Routine screening colonoscopies may not always be necessary for certain adults after age 75, depending on their health status and screening history. Colonoscopies have undoubtedly saved lives. They remain one of the most effective tools for detecting and preventing colorectal cancer. But as people age, doctors often begin weighing the benefits against the risks more carefully. A colonoscopy is an invasive procedure. It requires preparation, sedation, and carries small but real risks, including bleeding and complications. For healthy older adults with a long life expectancy, screening may still be beneficial. But for others who have had consistently normal results over many years or who have significant health conditions, the balance may shift. What's fascinating is that modern medicine is moving away from asking, "How old are you?" and toward asking, "How healthy are you?" Two people of the same age can have dramatically different health profiles. An active 78-year-old who hikes every week may have very different screening considerations than someone dealing with multiple serious illnesses. This is one reason why healthcare decisions become increasingly personalized as we get older. The goal is not simply to find disease at all costs. The goal is to improve quality of life and help people live healthier, longer lives. Sometimes that means doing more testing. Sometimes it means doing less. The fourth medical checkup that may not always be necessary is routine whole-body screening scans in people without symptoms. This is one of the most heavily marketed health trends in recent years. You may have seen advertisements promising early detection through full-body scans, advanced imaging, or extensive screening packages. The idea sounds appealing. After all, who wouldn't want to detect problems before symptoms appear? But medicine is rarely that simple. When doctors perform extensive imaging on people who feel perfectly healthy, they often discover what are called incidental findings. These are unexpected abnormalities that may never cause symptoms or harm. Once discovered, however, they frequently trigger additional testing, follow-up scans, biopsies, specialist visits, and significant anxiety. Many of these findings ultimately turn out to be harmless, yet the emotional and financial costs can be substantial. This phenomenon has become common enough that researchers have spent years studying the issue. More testing can sometimes uncover more information, but more information is not always better information. Think about it this way. If a test finds something that would never have affected your health, has that discovery actually improved your life? Or has it simply created worry and additional procedures? This doesn't mean imaging tests are bad. Far from it. Imaging can be life-saving when used appropriately. The important point is that screening healthy individuals without specific symptoms or risk factors deserves careful consideration rather than automatic acceptance. Now we come to number 5, and this is perhaps the most misunderstood item on today's list. Routine annual physical exams with extensive testing may not always be necessary in the way many people imagine. Now, before anyone misunderstands me, regular contact with your healthcare provider remains incredibly important. Preventive care matters. Medication reviews matter. Monitoring chronic conditions matters. Vaccinations matter. Health discussions matter. What we're talking about is the assumption that every annual visit must automatically include a large battery of tests, imaging studies, and screenings regardless of individual circumstances. Many people believe that more testing automatically means better prevention, but numerous studies have shown that indiscriminate testing can sometimes lead to false positives. A false positive occurs when a test suggests a problem that ultimately does not exist. Once that process starts, additional tests often follow: more blood work, more scans, more appointments, more worry. The best preventive care is targeted preventive care. It focuses on the person's specific health needs, risk factors, symptoms, and goals. As we age, healthcare becomes less about checking boxes and more about thoughtful decision-making. The question changes from what tests should everyone get to what tests make sense for me right now. This shift represents one of the most important concepts in modern healthcare. Many older adults spend decades following the same medical routines without realizing that recommendations evolve over time. What was appropriate at age 45 may not be appropriate at age 75. What made sense 10 years ago may not make sense today. Medicine continues advancing, researchers continue learning, guidelines continue changing, and that's a good thing. One of the healthiest habits you can develop is becoming an active participant in your healthcare decisions. Ask questions, understand the purpose of a test, ask how the results might change treatment, ask about potential risks. Ask whether the benefits outweigh the downsides for your particular situation. These conversations can lead to more personalized care and often better outcomes. It's also important to recognize that avoiding unnecessary testing is not the same as neglecting your health. In fact, sometimes the most responsible medical decision is choosing not to pursue a test that is unlikely to provide meaningful benefit. Healthcare should always be guided by evidence, individual circumstances, and informed decision-making. If there's one message I hope you take away from today's video, it's this: age alone should never determine your healthcare plan. Your overall health, personal values, medical history, and goals all deserve a seat at the table. The best doctors understand that good medicine is not about ordering every possible test. It's about helping each person receive the right care at the right time for the right reasons. And if you're over 65, that principle becomes more important than ever. I'd love to hear from you. Have you ever had a screening or test that left you wondering whether it was really necessary? Or have you had a preventive test that helped catch an important problem early? Share your experience in the comments below. Your story might help someone else make a more informed decision about their own health. If you found this video helpful, make sure to subscribe and turn on notifications so you don't miss future videos about healthy aging, longevity, senior wellness, and practical medical advice. Thank you so much for watching. Stay informed, stay proactive, and I'll see you in the next video.